to us. So we had a question.
Good morning, Magdalene. And good morning to my wife, Martha Larbi. She's listening. And my mother and a lot of colleagues in Confirm.
Good morning to you guys. So there's a question from Angie saying that good morning, doc. She says, I'm 3 months pregnant and the scan revealed I have a fibroid as well. So please, am I safe to carry on? Or she's asking if her baby is safe. And this is quite common. Dr. Asune and Dr. Larbi, like, she takes a scan, she's pregnant, and then they say, oh, there's also a fibroid. Can she safely continue with the pregnancy? Does she need to go and see just the midwife, or does she have to step it up?
Okay, so ideally, pregnancy and fibroid shouldn't coexist. Okay, but the fact that you develop a fibroid doesn't mean that most women would carry the pregnancy to 9 months without any events.
Okay.
A few will have challenges along the way. So this is what we term as a high-risk pregnancy.
Okay.
So we would advise her to see a gynecologist and make sure that subsequently her antenatal clinics is a gynecologist that would be attending to her and then monitor the growth of the baby as well as the growth of the fibroid. Okay. If there's anything untoward, I'm sure it will be identified earlier on and then it will be managed accordingly.
But, you're both here, so let me ask both of you this question. For someone like our friend who just sends the message, for someone like this, at what time should, the midwives decide that, you know what, it's 3 months though, but you have a fibroid. At what time should the midwives decide that, you have to go and see a doctor? Because sometimes people are attending a facility where there's no OBGY or there's no doctor to talk to. So she's 3 months, a scan says it's a fibroid. When should she be advised? Because I know she's still listening, that she should go and see a doctor or go to a facility where there's an OBGY.
The midwife should refer her as soon as it's detected. So now that it's been detected that she has fibroid, she should refer to see an obstetrician. Right, because as we speak, we don't know the size of the fibroid. We don't know the location of the fibroid. Sometimes, most, as Jemima said, most pregnant women who have fibroids will not have a problem and will carry the pregnancy to 9 months and deliver normally. But fibroids can also, first, one thing is that fibroids can prevent you from getting pregnant.
The fibroid itself,
yes.
It can prevent you from getting pregnant.
Jemima also mentioned that the fibroid can also, if the inside of your womb is distorted by the fibroid, it can also cause miscarriages.
Yeah.
Now, some fibroids, because of their size, can even affect the growth of the baby. Yes. And those are huge ones, all right? You should be competing for space.
Yeah. So your baby is growing, the fibroid is also growing.
Yes, the fibroid is big, and baby needs space to move around, all right? Some fibroids can cause what we call severe pain in pregnancy, which we call degeneration. And that's because you see, fibroids too are in the womb. They also depend on blood supply. But if they outgrow their blood supply, what happens? It's like when you sit down in the wrong position and we say Anansi, it's because the blood flow to that part of your leg has been reduced. When fibroids the blood flow to the fibroids gets reduced because they've grown too big, they can undergo what we call degeneration and it causes pain. One thing I would like to also add is that the location of your fibroid can determine whether you are going to deliver normally, that's vaginally, or you need a cesarean section, because sometimes the fibroid may be in the lower part of the uterus, okay, and will be causing an obstruction. So that's why our friend has to come, so that we evaluate and know whether these fibroids are not the type that will
require any intervention.
Or we have to find out and plan that maybe because of the size and location of her fibroid, we have to counsel her and plan that and evaluate her, because for some people, their fibroids may require that they can't deliver vaginally, so we have to do a cesarean section for them to deliver the baby through their abdomen, because the baby can't come
out
the vagina.
Okay.
The other thing is that fibroids can cause heavy bleeding after delivery. which we call postpartum hemorrhage. You see, when you deliver, the womb contracts.
Yes. Yes.
All right. So can you imagine if you are trying to wring, you've washed your towel, and you are trying to wring the water out of it. Now, can you imagine putting maybe stones inside and trying to wring? Will you get the same effect?
No.
Right. So if fibroids are within the womb, and they are preventing the womb from contracting to squeeze the blood vessels and prevent bleeding after delivery, excessive bleeding after delivery. The fibroids can cause the blood vessels to remain open, and you can have heavy bleeding after delivery.
Wow.
So what our sister needs is to be evaluated for us to know what she will require. Right. Yeah. So she needs to see an obstetrician.
So Angie, you heard it there. You need to see an obstetrician. Trust me, there are plenty. There are plenty. They are the most produced doctors in the system, and I boss me boy. There are plenty. There are plenty OBGY people that I know, and today have 2 here. So ideally, and I don't know where you attend clinic, but ideally your midwife should write your referral, and then you can just go to Confanoche. It's still room 8 and it hasn't changed.
Yes, it's room 8.
Okay, it's still room 8. Listen,
you can also report to room 5 at the family
room 5 at the family medicine. So Angie, you can go to room 5 at Confanoche Poly. Yes. Okay, room 5 at Confanoche Poly, and you'll be seen, and somebody will give you a direct referral to room 8 at Confanoche. If you live far away from Kumasi, find the nearest district hospital, see a midwife, and they will give you a referral to go to a facility that has an OBGY, because it's important that you get the kind of help, you get the kind of advice, and then you get the kind of care that you need. 3 months is not too far gone yet. 0548501584. You're on the Orange Health Lounge. We're here, yes, every Saturday from 8 a.m. to 10 a.m. And on this show, we only talk to those who know about health, and we ask them the questions that you want to ask, and we give you a chance to also ask your questions from home. So 0548501584. That is the number to call. So one of our very good and regular listeners, John from Tech, is saying that how regulated should the use of estrogen-based contraceptives be in the management of fibroids? He's asking that how people use estrogen-based contraceptives in the management of fibroids. I'm an OBGY, I don't know, but John wants to know, like, how regulated should it be?
Okay, so if you look at the growth of the fibroid, they feed on estrogen. Okay, estrogen is more like the main food for fibroid. So we don't give estrogen only contraceptives to manage fibroids. We give what we call the combined oral contraceptive pills. That's estrogen and progesterone. And usually it's not on a long-term basis. We give those combined oral contraceptives to manage excessive bleeding. If you have a fibroid that you are bleeding so much, then we put you on that, mostly to control your bleeding, build up your blood level, and then work you out for surgery. Okay, so it's not something that the patient, the lady should be on for, let's say, a year or more than a year. Usually we put them on maximum 6 months, but they would have been able to control the bleeding and then work the patient out for surgery. And we always, like we said, always make sure that it's an obstetrician gynecologist who is attending to you. Because if you go to the pharmacy to get these medication because you've heard that, these estrogen pill, because too much of it also has its own effects.
Side effects, yeah.
Yes, especially on the lining of the womb. Okay, it can cause what we call endometrial hyperplasia, too much growth of the lining of the womb, the carpet that we shed, and that can predispose you to other conditions. Rarely you can get malignancies from that. So it's a medication that only the qualified professional should be able to prescribe for you. So I'll advise that an obstetrician gynecologist do the prescription and then do the monitoring for the clients rather than going to buy it yourself.
All right. It's always good to see an obstetrician for obstetric related issues. Don't we always say don't Google it, don't chat GP it. Now we have to add that. Don't chat GP it.
And the AI.
Yes, don't chat GP, don't AI it, and look for care. You know, we have human beings. Human interaction is extremely important, especially when it comes to care. 0548 501 584 0548 501 584, and Angie says that she's going to go to room 5 at Confanoche, and she'll come and see you, please. That's why we love Confanoche. Like, it's there, plenty human beings work there, plenty great people work there. So if you have a challenge,
Tell Angie to come and see Jemima.
So Angie,
Jemima, what's your day? Your clinic day?
Oh, my clinic days are Fridays.
Okay,
Fridays
so
in room 8.
yeah,
Room
room 8
8
Fridays. Dr. Jemima Asune is there. She's preparing for her exam also. Hot day inside small. Hot day inside small.
and I'm in room 8 on Wednesdays.
Yeah, room 8 on Wednesdays.
Yes.
Like the big boss himself is room 8 on Wednesdays. Take a referral and go there and say you want to see Dr. Larbi. See, they'll let you see. There are plenty OBGY. I mean, great people there, and I have very good memories of OBGY. They all thought I would do OBGY, but some of us ran. We ran away from the punishing schedule of the OBGYs.
But you worked very well there, so that's why we thought you loved OB.
Anyway, that's sorry for another day. 0548 501 584 0548 501 584. That's a WhatsApp line. So just pick up your phone, send a voice note or send a text, and let's know. We've been talking about fibroids for the past hour. I know the questions keep coming thick and fast. Some are sending it privately. Yes, I get that. So, besides taking a scan, someone is asking, is there a lab test that you can do to show that you have a fibroid besides taking a scan?
All right. Let me say this. In medical interaction with the patient or in the management of the patient, we do what we call history taking. So you ask the patient questions. Of course, some people will come to the hospital with a scan already, which shows a fibroid. There's no blood test that diagnoses fibroids.
There's no blood test.
There's no blood test
Okay.
that diagnoses fibroid. If one was developed last night,
Yes.
so there's no blood test. So this is how we diagnose fibroids. First, by talking to the patient, what the patient tells us gives us a suspicion, and then we do our physical examination. So we examine you from head to toe to find out how you are generally. Blood pressure is always constant in every clinic, all right? And then we will examine you. When we come to the main place, which is the abdomen, then we also have a way of examining the abdomen. And then, if need be, we may even ask for what we call a pelvic or a combined abdominal pelvic examination, where we will ask for the consent of the patient to do a vaginal examination in combination with an abdominal examination to look to see whether the womb is enlarged. But sometimes even the womb is enlarged such that you don't even need to do add the vaginal.
You can just see.
You can just you put your hand on the abdomen and then you can feel this firm huge mass. So the masses come in different ways, and then we then follow up with an ultrasound to confirm, because not every mass in the lower abdomen is a fibroid. Though the commonest is are fibroids, not every mass, because sometimes the ovary too can become enlarged, or other structures in the lower abdomen can also develop, masses as well. Yes, so that's it. So as I said, some people these days, because ultrasounds are very common, some people will even walk into the scan center and get a scan done. So by the time they are coming, they already have their scan.
Yeah.
But when they come, we don't just take it on that it's a fibroid they have. We also have to ensure that the symptoms they have are due to the fibroid,
The
or
fibroid.
it could be that the symptoms are due to something else, and the fibroid is also there, but not causing any problem, and the problem they have is due to other things. Yes, thank you.
So someone is saying I used to bleed so much I would get dizzy. Wow, and that's how I knew I had a fibroid. Said she could bleed. People can bleed till they get dizzy.
Yes,
Yes.
some even collapse.
Wow. There's nobody who has collapsed that should give them masking you.
I'm telling you.
It might be something else altogether. Yeah, she said that she used to bleed till she could get dizzy, and that's how her friends took her to hospital, and the doctors were able to detect that she had a fibroid. And she said that that was the day she decided not to play with some things like that, because she had been bleeding for over a year, and she had no idea it was a fibroid. And that God bless the doctors who saved her life. Yes, 0548 501 584. This morning we're talking about uterine fibroids, all the things you hear on radio, fibroid. I'm going to answer a very obvious question that most people think about, and the OBGYNs, they hear it every day. Are there medications that melt, destroy? Usually they say a banana or fibroid. No? Are there medications that melt fibroids? Please, this one, the general public is listening. Are there medications? You tell us if there are, so we can all go and look for it. Are there medications that melt fibroids?
I'll be very happy if there were medications that melt fibroids, because some of our surgeries, especially the one we call myomectomy, for people who want to preserve their womb. So it's a surgery where we take out the fibroids, but we and then we repair the womb. Some of them can go for hours.
Yeah.
For hours.
Yeah.
I have some pictures here on my laptop, but unfortunately we can't show them. Look, you can go as far as removing 60, 70, 90 nodules.
100.
Now,
You can remove 100.
yeah, it depends.
Yeah.
Some people have maybe 3 huge fibroids,
Yes.
which have enlarged the womb.
Yeah.
Some people too may have multiple
Small
of
fibroids.
different sizes and in different locations.
Oh.
And what you want to do is that you want to remove them and reconstruct the womb so that the womb can perform its function. All right, and it can take you hours.
That's the one
The
that if you are
fibroid
the resident,
surgery-
then you're already tired before the surgery begins.
I did one surgery, and I remember telling the surgical team who were with me that if anyone was in an airplane, in a flight from flying to London, the person would have arrived before I finished the fibroid surgery. So if there were medications to melt the fibroids, in fact, gynecologists would be very happy because it will make the treatments of our patients very easy. But Jemima, is there any?
We are not aware of any medication that melts fibroids. It says sometimes the fibroid undergo some changes based on how big they are. You know, my director mentioned earlier on, we call them the degenerative changes. Okay, and there are so many forms of degeneration. Sometimes they can become as hard as a stone. Sometimes they can become almost like it's fat. Okay, so when they degenerate in a fatty nature, you might think that because when you feel it, you not feel that
You don't feel the hardness.
the hardness like before, but so you might think that it's melted or it's resolved, but it's still there. The moment you go fibroids, it doesn't disappear.
So it can undergo
Some changes,
some sort of fatty degeneration, then it
Yes.
becomes a bit soft.
softer, exactly.
But it's still there.
But it's still there. It hasn't gone anywhere. Give yourself some few months, you feel it again. Exactly. So sometimes that is the misconception outside. When they undergo those degeneration and then they can't feel it that much, then they think, it's melted, it's disappeared, and people are making money out of
People are
that.
making a lot of money. But
So
those
the fibroid is still there.
people are making a lot of money from that concept that
Exactly.
if you drink this concoction that I have, it melts away your fibroid. Please, there is no medication that can melt a fibroid. None. Zero. Zilch.
It does it.
One of my patients I managed about a couple of years ago, after the surgery, just told me that I've spent so much money
Yeah.
and I should have reported
Earlier.
because she was being told about one concoction or the
Yeah.
other,
Yeah.
and also being told by some pastors
Mhm.
and so on that they
Mhm.
were going to melt the fibroids.
Yeah.
Some of them were even giving them some drinks that they prayed over.
Hmm.
I believe in, I'm a Christian and I believe in miraculous healing,
Mhm.
all right? But let's remember that God has also given us talents and also given us the knowledge that we have to manage these things. So if you are a pastor and a patient comes, your church member comes to you reporting of a medical condition, what you have to do is to give them the spiritual support, but tell them to report to the appropriate place to be evaluated.
Yeah.
Because going to a hospital does not mean you don't have faith.
Mm.
Going to the
Mm.
hospital means you are taking advantage of the knowledge and the skills that God has endowed the professionals with.
So
I wish you could project the pictures
yes.
for people to see whether this thing has the
No,
potential
you know,
of melting away or not.
So usually the practice I have is that when I do a myomectomy, I usually keep the noodles and then post surgery. I always say these are the things that we removed. You can even touch them. It's hard, like they are firm. It doesn't matter what you pour on them, they're not going to melt. So please, this is public service announcement. Don't, like Dr. Larbi said, follow people who know next to nothing about what they are dealing with, and they'll say, "Oh, buy this, drink that, it will melt it." Fibroids do not melt with any medication.
And if anything melts in your abdomen, where will it go?
Where will it?
You see, when something melts, it turns into a liquid.
Yes, and it's
So
supposed to.
where will it go? We know when liquids melt. When we remove an ice cube from the freezer and it melts, it turns into what?
Water,
Liquid.
yeah.
All right? And depending on where it is, you see the surface is slanted, it will flow. Right? So if you have a fibroid and it melts, where will it go? Now, one myth, when people are drinking the herbal concoctions, all right, and the concoctions are not working, and they continue to bleed heavily, and sometimes the bleeding is coming in huge clots. Those who are selling those concoctions tell them that it's the fibroid that is melting. Meanwhile, they are becoming anemic. The fibroid is still there, and you are rather bleeding. So that is one.
So the medication that you are taking that is causing you to bleed a lot. It's not the fibroid that is coming
You are
out.
taking the medication, but it's not working. You are still bleeding, and when they go back telling them that I'm still bleeding, they'll tell them that fibroid no bleeding. Meanwhile, they are getting anemic, so they end up coming like our sister mentioned that for a year, she actually collapsed and was sent to the hospital. And that's a common scenario. Yes, one extreme scenario that I remember is a patient who had anemia, and she developed heart failure from the anemia and died. Wow. Yes, and normally fibroids don't kill.
Yeah.
But if you neglect the anemia, then the heart overworks and the heart fails. Then then death can take place from that. Yes.
This is 107.9 Orange FM. We're 18 minutes past 9 here on the Health Lounge, and this morning we're talking about uterine fibroids with Dr. Larbi and Dr. Jemima Asune. Good morning to you. She's saying that salute my boss, Dr. Larbi, for always being humble and educating nurses during ward rounds, so that you work with him at Living Waters Hospital. Good morning to you also, Achua, who is listening to us and saying that there's a lot that she's learning this morning, and that she's grateful that we've taken our time this morning to explain to people what fibroids are and what fibroids are not, and what people should be doing to take care of themselves. She adds on that one of the other challenges with people being diagnosed with a fibroid is that many people do not understand that this is a medical diagnosis and needs medical care. Saying that oftentimes once people have a fibroid, the first thing they think about is to take a concoction to let it go away. And she's happy that we're making people understand that these concoctions do not work. Let me announce the phone lines.
Let me quickly add this. You see, as the fibroid is growing in the uterus, it forms what we call something like a case around it, like a house. So we call it a pseudo sac, or let's say a case around it. So there's no way the fibroid would break that case and then exit. So far as it has a case around, it's protected by that case. So it keeps on growing bigger and bigger and bigger. Do you get it?
Yeah.
So unless we go in to take it out, there's no way this fibroid is going to disappear or will melt out of the uterus.
It's there.
It's still there because it's in its house.
enjoying time.
Yeah.
Let me announce the phone lines now. You can join us on our conversation this morning about uterine fibroids on the Orange Health Lounge. 0541 022 318 0541 022 318. You can ask your question in Twi or English. We'll answer it for you. And like we always do, we always try and give a summary at the end of the show in Twi, so that sometimes people do not get the full conversation in Twi. But Dr. Larbi and Dr. Asune, let me ask, is there a local expression for the fibroid? Is there a Twi or a Ga or an Ekapim or none? Alright, let me pick this call.
All what I hear is fibros.
So when people commonly refer to as fibros,
yeah.
That's what. After the cheese, yeah, there's something like that. But so it's fibroid, not fibros. So 0541 022 318 0541 022 318. That's the number to call if you've got a question for us this morning about our discussion as well. But people usually think that once we say fibroid, it equals to surgery. Is that the truth, or there are other modalities to the management of a fibroid?
Yeah, so when you have fibroid, there is three parts in managing it. We have what we call the expectant, so we are just watching it. And usually for women who have fibroid, but it's not affecting them in any way, they don't have pain, they are not bleeding excessively, they go about their normal activities, they are not having problems with conception. They get pregnant, they deliver, they don't have issues with it. So far they have the fibroid, and after evaluation, we've noticed that it's not causing any harm to you. There's that option of observing it, but we do serial monitoring. It's not that we just leave you to go. We give you time for you to come for follow-ups, checkups. Then we see if there are any changes that are suspicious, or if we think it's now beginning to cause a distortion, or it's beginning to give you symptoms, then we will now plan and work on it. So that's one way of going about managing fibroids. The other way is we can give you medications, especially women who bleed excessively, and then let's say she hasn't decided whether she will go in for surgery. We cannot just leave you to go away. Otherwise you go and bleed and die. So we put you on certain medications to control the bleeding. And possibly to even stop the bleeding aside your normal menses. You get it? So that's another way. So that's the use of medications to manage the fibroids. Sometimes if you are lucky, it shrinks it up a bit, reduces the size a bit. In situations where we are planning for surgery, but we notice that the fibroid is too huge, and then there's a risk of you bleeding excessively in theater, we put you on some of these medications to reduce the size and then to control the bleeding, so that during the surgical procedure you will not bleed excessively. Yes, so those are some of the I don't want to mention
No. People go around looking for them to buy
medications. Exactly. So we can give you medications to control your symptoms. We can observe if you don't have any symptoms and it's not affecting your quality of life. or we do surgery for you if it is really affecting your quality of life.
So, like Jemima has put it, it's not just every time you hear you try fibroid, then your mind should go straight to surgery. And even if there's going to be surgery, it's a process. You know, they take you through a process to evaluate the size and where it is. Ajwa comes back and she's saying that sometimes the positions of where the fibroids are very difficult to detect. Saying that I was told that my fibroid is at the back of my womb, and that is why it had not been noticed until she was having her cesarean section, and that is where they realized that she has a fibroid at the back of her womb. By saying that my doctor said he was not going to remove it because I was pregnant and he was scared I was going to bleed out. I took it out later anyway, after a couple of years. So sometimes you can find a fibroid, but you don't remove it.
Yes.
Oh, but you see that.
As Jemima has actually, elaborated on the management, as she said, you observe medical management mainly to control bleeding, and then we have the surgical. For some people, probably they had a scan. As I said, sometimes the report will depend on the expertise of the person. The quality of the report will depend on the expertise of the one who did the fibroid. Yes, because if you have a huge fibroid, a good machine, also a good ultrasound machine, and an experienced sonographer, a fibroid of that size, it doesn't matter where it's located, you see it. Yes, you see it. We obstetrician gynecologists, we do a lot of scans. He said ultrasound is one of our tools. One of our tools, right? We use them more than we use stethoscopes.
Come to think of it, I haven't seen an obstetrician with a stethoscope.
I have more than one.
Come to think of it, I haven't seen an obstetrician.
It doesn't come to work most of the time.
Obstetricians and stethoscopes are not best friends.
We use them, especially the obstetricians who are into the maternal fetal medicine. We use stethoscopes a lot because we handle women with medical conditions. But coming back, yes. You see, when you do a cesarean section, the woman is pregnant. At that time, the womb is highly vascularized. The blood flow to the womb in a pregnant woman is about, at the time the woman is 9 months pregnant, it's about 600 mils per minute. Can you imagine that you have a bottle, this 500 ml bottle that I'm holding, worth or more worth of blood flowing through the womb every minute? Yes, every minute. So the womb is highly vascular. So at cesarean section, if the fibroid, what most obstetricians should do is that if the fibroid is not in your way, where you have to cut to remove the baby, they are not likely to remove it because of the bleeding. Or if it's the fibroid that is maybe such that its attachment to the womb is small, so it's just easy to just clip it off and repair that site. Yes, but like she's saying, a huge fibroid behind it. There are different schools of thoughts. There's something we call cesarean myomectomy, where after removal of the baby, you put something around the womb to reduce blood flow to the womb, and then you take out the fibroids as well. So the woman has a cesarean section, and she also has a myomectomy, a removal of the fibroids at the same time. Okay, but in medicine, sometimes there are areas where some doctors will lean towards one side, where they will say, no, I'll just remove your baby, and then you come at a later date to remove your fibroid. And others too will say, I'll use this opportunity to take out your baby and remove the fibroids as well.
Okay.
So those options are also there.
Okay.
Yes.
Okay. So it depends on your doctor, his expertise, and even the size of the fibroid. So please, don't force your doctor to do something that he's that he probably might risk your life trying for you. Yes, Angie, don't worry, we don't recommend medications on the show. I always encourage you that go to hospital, and the doctors, the midwives, the nurses, the people in the hospital, they're your friends too. Tell them what is bothering you, because what she's saying is that every time she goes to hospital, they say she's anemic. Yes, but we do not recommend medications on this show.
Does she have a fibroid?
Yes. Because we need to find out the cause of the anemia.
So she should report.
Yes, when you report, they will do all the investigations that they need to do. Sometimes it's not even about getting a blood tonic. Sometimes you need to be transfused.
Yes.
Sometimes you need to be given blood, because the level of your anemia is so low that it's not just about medication. So it's something that you need to pay attention to. I think the last time, correct me if I'm wrong, I think Confanoche was, you launched some minimally invasive something. You're doing some high-tech laparoscopic things. So maybe I don't want somebody to have a cut. Can you remove the fibroid through laparoscopy? Can you do keyhole surgery to remove a fibroid? Because there are people who may be thinking that they're going to lie there for them to cut this thing. I'm not comfortable. Are there any other means to remove a fibroid besides what we all know?
Yes.
Okay.
You were talking about minimally invasive surgery. Currently, we have laparoscopic services in Confanoche.
Okay.
Right. And the laparoscopic services are evolving, they are developing. So we are yet to get to the point of removing the fibroids.
I think
they've started. Okay, I'm not in that group, but I know that we have we have some of our colleagues who have been trained, and they are doing the laparoscopic surgery, what some people will call keyhole surgery.
Okay.
So what happens is that instead of making maybe a 10 centimeter incision on the abdomen, or even sometimes more, to get more space to deal with the fibroid. Now you can work through small incisions, maybe 2 centimeters, and then you put in a camera, and then you make other small incisions, all right? And these, you insert instruments through these other small incisions, and the camera is showing you on a large screen everything in the pelvis and the abdomen. And then you'll be watching, the surgeon watches this screen and uses the instruments. He's manipulating them outside, but the instruments are doing the work inside to so that what we would have done through a big incision is now being done through little incisions. And by the time you are done with the surgery, you have just some tiny scars left. And in some cases, you can even your hospital stay is shortened because you have a smaller incision, and you have less risk of maybe developing other complications like a wound infection or a hernia and so on. So yes, but one thing I would say is that some of the fibroids that we see in Confanoche cannot be removed by laparoscopy, because you even have the space to put in your laparoscopic gadgets, because they are too huge. So beyond a certain size, we will not recommend laparoscopy surgery, but below a certain size, laparoscopy is feasible.
Okay, so 0541 022 318, 0541 022 318. So Georgina sent a message earlier. She's saying that said I'm past menopause, and I would think that if I had fibroids just before menopause, after menopause, should the fibroids not reduce since they feed on estrogen?
Yeah, she's right. At menopause, the estrogen level goes down drastically. And you realize that the fibroids, they feed on the estrogen to grow. So if you have a fibroid and then you get to menopause, you attain menopause, naturally they begin to shrink.
Okay.
Yes.
But they will still be there,
They will
even
still
though
be
they
there,
shrink.
but they shrink.
Okay.
And then all the symptoms that you used to have, most of them resolve. So usually if you are closer to menopause or at menopause, we can use other modalities other than surgery, depending on how you present, and then monitor you so you get to menopause, and then you realize that it will shrink.
So there's a comment from a husband here. Okay, let me re-announce the phone line: 0541 022 318 0541 022 318. You can call if you have a question. So a comment from a husband here is saying that my wife has been diagnosed with a uterine fibroid, and we've been given the option of either removing the fibroids or removing part of her womb. Saying that I want to understand that. So just want to understand. So I'm just thinking.
We have more questions to ask because, as we said, when it comes to the surgical management of fibroid, it's either we are doing surgery to preserve the womb, which we call a myomectomy, means removal of myomas. Fibroids are also called myomas.
Okay.
Yes, so a myomectomy. Or we are doing what we call a hysterectomy. Hysterectomy means removal of the fibroid.
So let me pause. Let me take this call and then we'll continue. Hello, good morning.
Hello?
Yes, good morning.
Good morning, how are you, doctor? I'm sure you're in a family.
I'm in so.
What about you? The city body being very 48 right now. Yeah. Now, we said you pleaded, Papa, that we call also come on and look always can check. Now, obviously, any problem, yeah. But still, the thing
but just in feeling you're saying
48.
48. 48. Okay. Okay. All right. Thank you very much. That's it. 0541 022 318. No. 0541 022 318. Yes, that's the call line. If you have a question to also ask, just like she did. 0541 022 318. Yes, so she says she's about 48 years old, and that's her concern. Bleeding a lot. Even though she's done a scan, and she says that yes, she knew.
Okay, I'll answer in three. Sister Opare, sister now see what the in fear 48, you know, 9 watch. Oko hospital also almost say who bleed deeper so train your patrol bleeding beer and normal, which I say bibi koso. I will say a swan. Inti minim baby a crew was any baby out. Now I was say we call baby a ubenya specialist gynecologist. Ubi a unim wesua imma ho adwuma eye na wahwe if he say bibi koso. Inti na wo bleed sa no. Inti also wo ba na meka se na sa ana nine. Yes, pay follow back over me on the age 53 as a 54. Also by no say also bleed or can am see there be bleeding way there or say go munti at local theater and ye call rare na would him essence rare na would no and ye call lab inti bi wa na woni fibroid na so awudi enimu ankasa ne awudi na no ahwa na yare wo inti also ba ne hwe adekro yes if say enye normal say bleed bibi koso inti patro eni say ka say enye hwe
okay all right, so let me pick this next call. Hello, good morning. Hello, good morning. you can call back 0541 022318 0541 022318. That's the number to call if you've got a question to ask us on the show.
Husband who sent the message, we didn't complete
Yes.
Wife has been diagnosed with fibroids, and they've been given the option of removal of the fibroids or removing of part of the uterus. Now, I would like them to supply us some answers. How many children do they have? What are her symptoms? You see, usually when someone has fibroids and we say we are going to remove the womb, then it means that most of the time, the first thing is, has the woman completed her family? There's no further wish for children. Or the fibroids are so extensive that we can't do a myomectomy. In fact, we've had a few cases of women who have never had children.
Okay.
A few cases, a small percentage of cases of women who have never had children but had to have their wombs removed because of the severity. But majority of the time, for women who have not had completed their families or who have the wish to preserve their fertility, we actually do what we call a myomectomy for them. So for our brother, the husband who talked about his wife, we need more answers. How many children do they have? Have they completed their family? What are the symptoms of his wife? Then we can be able to make some recommendations. Ultimately, what they need maybe is a second opinion from an experienced gynecologist.
Okay, so let me pick this next call and then we continue. Hello, good morning. Okay. Hello. Sorry. Can you reduce the volume on the radio set so as we can hear you? Hello, good morning.
Morning.
Yes, great. You can hear
I'm 6-year-old woman. And I got my menses 2 years. I didn't get menses. It's after 2 years that I had my menses again. And then I've been something taken in my abdomen. So I didn't know what is wrong with that.
So how old did you say you are, please?
52.
52.
Yeah.
Okay, and can you repeat your question again? So there was...
I didn't get what you said.
Can you repeat your question, please?
I said I'm 52. At the age of 50, I was not breathing again. So after 15 years, 2 years, I didn't get my notice. So one day I was there in just 1 day. So after that, I've been finding there's something taking under my abdomen.
Okay, all right. Thank you very much for your call. 0541 022 318 0541 022 318. So she's 52. When she was 50, her menses stopped coming. After 2 years, she decided to show up for just 1 day, and now she has this funny sensation in the abdomen.
Okay, so first of all, from what she's narrated, she attained menopause. And then 2 years down the line, she started bleeding for 1 day. It's not normal, because when you get to menopause, you shouldn't bleed. The moment you see any blood, we need to investigate. Is it something that is dangerous or not? So for her, I would advise her not to waste time at all.
Yeah.
She needs to get to the gynecologist. Please get to the obstetrician gynecologist, because time is of essence.
Yeah.
If it is something that is malignant or something that is cancerous, the earlier you get there, the better the outcome. But if you go round and round and then you report late, sometimes it's quite challenging to handle them. So I would advise her to get up, pack her tools and come and see the gynecologist as soon as possible. Some may say, oh, it's just one day, so let me just overlook it.
Yeah.
No, it's not normal for a menopausal woman to bleed. Be it spotting for just 1 second, 1 hour, no. You come and then let's do this assessment. If after the assessment we think it's something that is not conscious, then we go along that line. But if you pick something that is conscious too, then we work it out for it. Yes. So she should come and see us as soon as possible.
All right. 0541 022318 0541 022318. Our friend comes back and says that yes, it's important that husbands accompany their wives to hospital because he says that my wife and I will go to Confanoche next week. Yes, kindly go with her, and let's just be part of the conversation. Be part of the conversation. Don't isolate yourself in the house. Be part of the conversation, just so that you can help make an informed decision about the next steps. 0541 022318 0541 022318. That's the call number. Dr. Sen, the club, someone is saying that she had a myomectomy, but she was told that there are, she said, seeds. So there are seeds of the fibroid in my womb. So I was advised to get pregnant early. So I've been trying unsuccessfully since then. Says I don't know whether it's psychological or it's because of those seeds. And what are those seeds?
Okay, so the seeds are simply, the myoma, the sizes are very small when they start growing. They are very tiny.
Right.
Some the naked eye might not see it.
Okay.
So as it grows, it begins to become bigger. So I'm sure the seeds they are talking about are the very tiny pieces that usually it's quite difficult to take during surgical procedures. So with time, they'll also grow to become bigger and start giving you issues. That's the symptoms. And for the pregnancy, the fact that she's not getting pregnant, we cannot sit here and attribute it to the myomas or the fibroid. She needs a thorough workup. Because sometimes, the fibroid can cause that, but there could be other challenges or other conditions that she might be suffering from. That could cause she not conceiving, her inability to conceive.
Okay.
Conception is not just the woman. It's both man and woman. Do you get it? But in our setting, usually we look at the woman.
We look at the woman. So
yes.
For those who are watching on YouTube, Dr. Larbi has been kind enough to share some pictures with us. So just go on YouTube, go to Orange FM, click on the live link. You can see live images of this fibroid that looks like a complete baby with huge blood vessels. These are the things people are battling in the theater.
Yes.
This is big.
Yes, and so if this one melts, where will it go?
This is huge. But let me ask, when let's say the fibroids are many or they are so big and you literally have to pluck them out of the womb, can that womb conceive again? Like if you are removing 100 nodules from somebody's womb and you are reconstructing the womb, can that womb, can she conceive?
Surgery is an art. That's why, when you are training to become a surgeon, you are an apprentice.
Yeah.
So there are principles for doing fibroid surgery. If you stick to the principles, the outcomes are better. So for instance, if a woman, you look at the womb and you can see a number of fibroid nodules. You can gauge to place your cut on the womb to remove a lot of fibroids. So what you do is that you use minimum number of incisions to remove a lot of fibroids. You understand? So your incisions have to be placed such that you can remove a lot of fibroids through few incisions.
You don't go cutting in everywhere on the womb.
No, if you go cutting everywhere on the womb, then that is going to be a big problem.
That's butchery.
Yeah, yes, and so that's what you do. So if you follow the principles and you do a good reconstruction of the womb has potential, all right, to still have a baby. But one thing that we counsel our clients on when they are going to have myomectomy, that is fibroids to remove the surgery to remove the fibroids, is that once we are handling the womb and removing the fibroids and repairing it, one of the things that can happen is that just like when sometimes you get hurt on your skin and when it heals, you have a scar. We have internal scar tissue to that can form we call adhesions. So when the womb is healing, sometimes you can have adhesions forming around the womb. And some of these adhesions can cause maybe the tubes, the fallopian tubes through which, within which the egg and the sperm meet for fertilization. Sometimes the tubes can become blocked or kinked. So it's something that, when you are going to do any surgery, before you sign the consent form to say, I will do the surgery, we need to tell you about the complications, possible complications. And one of the possible complications of fibroid surgery is becoming, maybe having a problem with fertility.
Okay.
But even be that as it may, if you get a problem after myomectomy, if we evaluate you and your husband, and let's say we find out that on the side of the woman, the tubes have been affected, but the womb is there, the cavity of the womb is there nicely, then we can then recommend IVF.
Okay.
That's in vitro, that we will call assisted fertility techniques or assisted reproductive techniques can also come in there, so that we can fertilize the egg outside and put it in the womb. Of course, it comes at a cost. Yes, it comes at a cost. So, but sometimes you may find out that everything is fine with the client who had a myomectomy, but the husband has a problem with the semen parameters, which we have to deal with. Yes.
0541 022 318. There's a very interesting question from. That's for men. We are primal. 0541 022 318. So a gentleman wants to know that how long after myomectomy can I go where? So he's saying that so he sent a text earlier that his wife had surgery done to remove fibroids because they were struggling with conception, and they were told that it was essentially because of the locations of the fibroids, like Dr. Jemima said it's been 5 months after the surgery, and we don't know when we're safe to try and have a baby.
I think 5 months is too long a time. Well, I don't know what went into the counseling, and I don't know what was seen during the surgery, what the surgeon encountered. And I don't know what counseling went on after the surgery. So it's quite difficult to recommend the timing. I would advise that probably they go back to see their surgeon and then make inquiries into when they can start having intercourse. But ideally, after myomectomy, we even encourage them to try and conceive within 6 months.
Okay.
To prevent the growth of other myomas.
Okay.
And usually, I think 6 weeks. It also depends on the general health of the woman. Some will recover faster. Others too, their recovery is quite slower. Some may have other conditions such as hypertension, diabetes, other comorbidities can affect your rate of recovery. So it's not like how do I put it? It's not like a principle for everyone. It's individualized based on how fast you recover and then your comorbidities associated. But some, I think within a month or 6 weeks, some resume sexual activities if they are okay.
If the woman is okay, and her general health
but
is
the principle is within 6 months
you should try and conceive. Angie says, last, can fibroid come back after removing it?
Oh,
Yes, Andy, we said it earlier.
One thing about fibroids is that there's recurrence. You see, because once you had a fibroid, it's a predisposition. It means you are predisposed, right? You have the risk.
You have the
so
risk.
removing the fibroids does not remove the risk.
Mm-hmm.
The risk still exists.
Yeah.
The only
Yeah.
time that we remove the risk is when we take out the entire womb. Then it means that there's nothing for fibroids to form on. But once you still have the womb after a myomectomy, you still have that predisposition to end the fibroids. In fact, recurrence rate for fibroids is about almost 50%. Yes, recurrence rate. Yeah.
Someone is asking, is there a fibroid clinic at Confanoche, seeing as there are so many cases of fibroids? Do they run a fibroid clinic? Something like that?
What we do is that, you see, we have our obstetrics and gynecology specialist service in consulting room 8. And over there, we see all gynecological and obstetric cases. And some of the cases we see are fibroids. So we don't have what we call a separate fibroid clinic. All right. So we have, when it comes to the high-risk pregnancies, we have a clinic for women who have complicated pregnancies. We have a clinic for couples who are having problems getting pregnant. All right. We also see clients who have fibroids, and then when we see them, after evaluating them, we put them on a treatment plan, which is appropriate for them. Yes. Yes.
Yeah.
So we are there from Monday to Friday.
From Monday to Friday.
And also, and from clinic should start at 8 and end when the last patients.
That one I know, room 8 clinic. Gosh. They leave when the last patient leaves. The last patient leaves at 6 p.m. So they are there. They are there Monday to Friday, consulting 8 at Confanoche, or you can go to Poly Room 5. Listen, like I said earlier, they are there for you. They are essentially there every day because they know that you're going to walk through their doors. And don't be shy about your problems where you see and obstetricians and gynecologists. They have seen it all.
Let me quickly add that very soon, Confanoche will be rolling out what we call our corporate and special services. Okay, because not every client wants to come to the regular clinic, and sometimes they want to see a specialist and to have, I would say, a more private interaction. So we are in the process of rolling out that service, and when it's rolled out, the public will know, so that people can book appointments to see, for instance, if you want to see a gynecologist obstetrician, not in room 8, but in a dedicated special consulting room, that can happen. Yes, so you can go there and have your appointment there, and it's going to be like you're having a private appointment, so you pay more for that service, and because it's different from when you're going to join the bigger clinic in room 8. Yes, so it's yet to be rolled out.
I think it's appropriate. I think it's important, and it's good to create different avenues for different patients to come in. We are 2 minutes to 10 o'clock. Time flies when we're having fun. Time flies when we're having fun. So I'll start with Dr. Asune. So any final words before we dash out of the studio?
Okay, so first of all, thank you for this opportunity, because I think it's been a fruitful discussion.
Exactly.
People have been made aware, and certain myths have been thrown out of the window. But I would like to encourage our young women, or every woman, when you start noticing any abnormalities within your system, be it your reproductive system or even any other system, your chest, if you're having headaches, so far as you've noticed that something abnormal happening, please don't waste the time. Get to the hospital, see a qualified professional to evaluate you. it's better to go for the evaluation and then you are declared that everything is fine than to dilly-dally and report at a later time when things are too late.
Yeah, true. Dr. Larbi, you had the final word. Dr. Larbi is the Deputy Medical Director of Confalogy, Senior Specialist.
Yeah, rapidly. In fact, what Jemima said summarizes it all. Fibroids are very common. We've talked about how they present. So as Jemima said, anytime you see a change in your pattern, let's focus on the gynecological system. Anytime you see a change, vaginal discharge, abnormal bleeding, pain, pelvic pain, pain during intercourse. Anytime something abnormal is happening, report to the hospital. Yes. And when you report, we will evaluate you and give you the appropriate treatment. I want to mention here that fibroids are not caused by white or gonorrhea.
Yep.
Fibroids are not caused by menses that last shorter than 7 days. Women are different. Just like some are tall, short, plumpy, slim, fair and dark. Others do have their menses for 3 days. Some have it for 5 days. Some have it for 7 days. That is how it is. And there's no drug available yet that melts fibroids.
Hallelujah.
Yes. And I would like to say that in Confalogy, we have a clinic where we do screening we do what we call a pap smear. Where we are screening to find out, to prevent cervical cancer. And we do it at the family planning unit. And please, our listeners should take advantage of it to come there for their pap smears so that we can see the health of their cervix.
Okay.
Yeah, so when you do it and we see any signs that you're having what we call a precancerous condition, then we can deal with it. If you come and we do the pap smear and the results show that everything is fine, then we can give you a time to come back for a repeat.
Okay.
It's very important because cervical cancer too is something that we have to talk about.
All right, boss. All right,
Thank you very much.
I'm here any day.
Thanks for the opportunity.
You're welcome. And that brings us the end of this morning's session. The Health Lounge is live on your radio every Saturday from 8 a.m. to 10 a.m. This morning you've been listening to Dr. Jemima Asune and Dr. Opare Larbi. You can tell they are experts, no? Join us again next week Saturday from 8 to 10 a.m. and also on YouTube from 8 to 10 a.m. and our show is recorded live on YouTube, so you can also go do a playback and listen to anything that you missed. As always, my name is Dr. Kwesi Jima. See you next week Saturday. Bye.